Preview. Preview. Preview.
Upon arrival of the patient, the nursing unit calls nuclear medicine, informing them that the patient has arrived. The nuclear medicine receptionist shall then inform the nuclear medicine technologist of the patient's arrival. The technologist then prepares the radioactive Iodine-131, which shall be brought to the patient's isolation room for administration. When the doctor arrives, it is the responsibility of the bedside nurse to endorse the patient to the referring physician. Before administration, the referring physician shall explain to the patient the therapy procedure as well as give the patient instructions on how to go about the procedure. During this time, the patient consent form shall be accomplished and signed.
Preview.
Personal protective equipment, or PPEs, shall always be worn by everyone who comes in proximity of the radioactive patient. PPEs shall include the lead gown, thyroid shield, and disposable gloves. PPEs are located in the anteroom before entering the isolation room itself. When the technologist arrives with the radioactive iodine, the referring physician shall confirm the patient's identification using the SLMC Patient Identification Scheme. Administration of Iodine-131 shall be performed by the referring physician, more technically known by regulation as the authorized user. After administration, the radiation dose rate of the patient shall be measured. The reading shall be written in the patient's radiation monitoring sheet. Likewise, the timeout checklist shall be accomplished and filled out. Before performing daily nursing care on the patient, it is important that nurses wear PPEs upon entering the patient isolation rooms. The nurse will then ask permission from the patient if he or she can enter the isolation room. When performing bedside care, nurses should always consider the 3 cardinal rules in radiation protection. Keep as much distance from the patient, use shielding as necessary, hence the PPEs, and keep time spent with the patient as short as possible. Doing all these without sacrificing proper bedside care, because, as we say, at St. Luke's, the needs of our patients come first. The nuclear medicine technologist shall perform radiation dose rate monitoring daily with the use of a radiation survey meter. When performing the radiation survey, The patient shall be measured 1 meter from the midsection, whether standing or lying down. The reading shall be written on the patient's radiation monitoring sheet. Patients should be instructed to increase their fluid intake, as this would help lower the radiation reading at a much faster rate. Incoming visitors should be asked to wear PPEs when entering the isolation room. They should also be oriented on the safe distance and time precautions when interacting with the patient. Information on the allowable time for visitors are also written on the patient information sheet. Food servers are allowed to enter the anteroom. Food trays can be placed on the anteroom bench, and patients should be informed that their meals are ready. Patient waste shall be collected every day. The nuclear medicine department shall monitor waste before disposal. Once the technologist declares that the waste is safe, it shall be endorsed to the housekeeper for disposal. Bed linen shall be changed as requested by the patient. The nursing assistant can perform the change, provided that they also wear the appropriate PPEs before entering the isolation room. Nursing assistants should also be aware to keep a safe distance from the patient and minimize time spent inside the isolation room. The therapy patient shall be discharged only when the daily dose rate is equal to or below 25 microsieverts per hour. The reading shall be written in the radiation monitoring sheet. The technologist shall endorse the reading to the bedside nurse. In turn, the nurse shall inform the referring physician. The referring physician will give final instructions, such as home medications and follow-ups, and then discharge the patient.